Good afternoon, everyone. I'm here to give us the regular update on the cases under investigation and the confirmed cases. So we remain of having 4 confirmed cases, and we have 16 new cases currently under investigation, 10 men, 6 women, and the age ranges from 2 to 66 years. All are in isolation awaiting those test results. Now, generally, I've been announcing that we've been having 6 cases under investigation has been a common theme, but the fact that we have 16 cases under investigation just reflects that we've broadened our testing. Our case definition is broadened to a focus on the Hubei province, not just Wuhan, and obviously any contacts of confirmed cases. So broadening the testing, and that's to detect any cases and take a very precautionary approach. We are also increasingly recognising that the disease profile can be quite varied. So obviously you've seen the symptoms of the more severe disease coming out of China. As I've indicated, our cases have been less severe, and in fact 2 of our patients have improved significantly. Therefore, we want to get out the message that people with very low levels of symptoms need also to come forward. So even if you have that bit of runny nose, you're feeling just unwell, please come forward, because we want to, both detect those cases, but also it will help us in our understanding. So we have tested well over 40 cases to work through them, and 36 of those were cleared and 4 cases were identified. We're certainly ramping up testing, and hence the explanation for the 16 cases. So nothing radically changed. It just reflects us trying to open up testing more broadly to better understand and detect any cases that might be in New South Wales. I probably have no other significant updates, but I know that you've got a lot of queries and questions, and then I might come back to a few issues. Before I go those questions, though, I just would want to urge your listeners to be careful in their engagement with social media. I have been seen personally sent a lot of social media posts that are just very wrong. Things like you can catch novel coronavirus by eating certain foods, you can catch novel coronavirus by going to certain places. I think the transmission and the passing on information like that just adds to community anxiety at a time where we want to provide a reassurance that we are taking a very precautionary approach. We want visitors from China and the Hubei province in particular to feel very comfortable coming forward to get tested and diagnosed, and giving them the reassurance that our health system will care for them, isolate them, protect our health care workers, and protect the broader community. I'll leave it there and take questions.
How concerned are you about the news that in Japan there's been a domestic transmission now?
That probably goes to why we follow up close contacts. So we know that the people that are most at risk from an infectious disease are the close contacts, and hence from as soon as a case is identified, they are isolated. We put in place measures to monitor and identify close contacts, and we follow up with them daily to assess whether they have any symptoms. And we're taking a very precautionary approach so that if they develop any symptoms, such as a sore throat, we're actually bringing them forward to get tested.
Of these recent cases, how many have travelled in the last week, and do you have the plane manifest to get in contact with other people that are on the plane where the contact may have happened again?
So it's important, and I think there may have been some misunderstanding when we referred to one case being a contact of a person. So let me be clear that 3 of the cases had spent time in Wuhan. So that was where they got exposed to the infection. In the other case, the person had visited another part of China, had close family contact with a person from Wuhan who was subsequently diagnosed with novel coronavirus infection.
But surely you'd want to get in contact with the people on these plane?
Yes,
to
so I'll
employment to
answer.
be all
So
banned?
I'll answer that question. So we are following up everyone on the plane, and the planes where people have been symptomatic, and there's also been a buffer period around that. So yes, we are, but I think I mentioned in my press conference yesterday that those boarding cards that people fill out, it's a message to please take more care when you're doing the digits on those boarding cards, and your email addresses that you write on those boarding cards, we have sent and communicated to those individuals. But we've also publicised those flights in our media releases and have promulgated that information also through a number of social media and other platforms. So yes, we have done our best endeavours for those flights where we have any concern that people may have been infectious. However, I would have to say that everyone from the direct flight from Wuhan actually received a full brochure, because their risk not only derives from being on that plane with that person who subsequently was diagnosed, but because they themselves have been in Wuhan. So they should actually be very aware of their risk, and they were given instructions to come forward, as did that case. I've got to say that that was exemplary in terms of the person presented to care, and I can report that there are very limited, if no, high-level contacts of that case because of the way that that case was managed.
Brendan Murphy mentioned in his press conference today that there's going to be some kind of phone hookup on the back of this Japanese domestic transmission. Is there any information you can give us about who that will involve and when that will happen?
So those teleconferences were happening, and currently the Commonwealth Chief Medical Officer is finalising the deliberations. It is a message to the community that every piece of new information that emerges is considered, and considered by a range of experts, and we are happy to adjust and willing to adjust our response to take into account any new information. And I know that can be frustrating, but it is actually prudent and reassuring, should be seen as reassuring to the community that we will respond to any new information presented. So the Chief Medical Officer will be providing some advice later today. That is being finalised at the moment, and I think it's preemptive for me to just finalise that. But we have discussed those cases and the information emerging overnight in detail.
Dr. Chant, what about reports that some people who have been to China more broadly have gone to hospital with respiratory illnesses and been turned away or been made to sit in emergency departments? How does that stand with the current guidelines for medicos in New South Wales?
So the focus is still on the Hubei province. We haven't had, whilst the situation is evolving, and again, this will how I answer this question today may be different from how I answer it tomorrow. But initially we saw the epicentre being Wuhan, and as a precaution we've gone to Hubei province, as we've indicated there's been some transmission outside Wuhan. In other places, people have clearly picked up from China, have clearly been infected, and as I said, one of our cases fits into that case example. But what we look at is whether there's sustained transmission in those settings. So that means that people that are not contacts of cases or not contacts of sick people could be infectious. So those are clinical decisions. I'd urge people, we have so it depends on what time in as the information is evolved, when they've presented, but we certainly have broadened testing, and whilst our focus remains in Hubei province, anyone who has contact with a known case of coronavirus will be offered testing, and certainly anyone who may have had a broader Chinese exposure on a case-by-case basis will be offered testing.
But surely it's not great for someone who's got a respiratory illness to sit in an emergency department waiting room for 4 hours.
We would advise, and we're happy to follow up that particular case, but our strong advice, and our emergency departments have to have things in place to manage patients with respiratory virus infections. So my advice and my comments now are irrespective if it's the novel coronavirus or influenza or RSV. All of these we do not want to be spread in our emergency departments to other members. So anyone who comes with respiratory symptoms, we would like to have a mask applied, or if they can't tolerate a mask, to be put in a single in a single room to isolate them, because regardless of whether it's this virus or influenza or other viruses, we do not want them to be spread to other patients in emergency departments. So I'm happy to follow up the particular case as well.
With regards to the surgical masks you just mentioned, I know that they're doing 1 million, that they will be handed out to GPs for people who've got respiratory illnesses or health issues. But given that the P2 masks are considered much better protection for health staff, should the government also be handing those out, do you think?
So can I just say, New South Wales has, we've just had a webinar with, would like to acknowledge the Royal Australian College of General Practitioners, and in particular Dr. Charlotte Hespy, who's been working closely with us. We've had 2 webinars with GPs and they've been incredibly well subscribed. The one on Friday evening, just before the long weekend, and we had over 400 attendees, and last night we had over 790 attendees. The issue of access for doctors to masks, surgical mask and P2 mask, was raised. So this morning we have contacted the primary health networks and are distributing supplies of both surgical and P2 masks to those primary health network, and for them to supply them on where the doctors can't procure the masks through the usual way. And I understand the Commonwealth will be stepping in to supply masks, but we felt the need to get them there today to some of the metropolitan PHNs, and we will be progressively working with the rural PHNs.
Should members of the public be wearing these surgical infected masks? I mean, we're seeing them fly off the shelves in chemists across the city. Is there any point in me or you wearing them when we walk out in the street?
So surgical masks are recommended for people that have got a coughing illness. They're basically, the aim is to protect the cough, and it's also not useful to wear the same surgical mask all day. It becomes contaminated. It actually isn't working. So regularly changing your surgical mask, and that's for people that are coughing, to prevent those coughs and the germs transmitted in that way from spreading. What we recommend for healthcare workers is to have the P2 masks. We are not making any recommendations that the general population wear masks. So therefore we really want to have them used by staff, people that are unwell. So we have also working with the Pharmacy Guild, because we have heard also that pharmacies are having difficulty stocking surgical masks, and that there's been quite a run on surgical masks. Our priority is just making sure that pharmacies themselves have a stock for the event that a patient comes in asking them a question, because we realise that pharmacists are a very important source of information for patients, and that people might come in, they might be coughing, and at that point, before they have that interaction with the pharmacist, we would love the pharmacist to have access to the surgical mask, to say, put this mask on, let me ask you a few questions and direct you to the care that you need. So we are working with the Pharmacy Guild and some of the distributors to see what the actual issues are with surgical masks.
But it's not necessary for a healthy person to wear a surgical mask to try and avoid getting coronavirus.
We're not making any recommendation for general wearing of masks in the community.
Dr. Chant, we had the news this morning that a laboratory in Melbourne has managed to copy this virus. When can we expect, or has New South Wales received a copy of that virus, or when can we expect some of the benefits of that and the tests that it will create to filter through to New South Wales?
I want to acknowledge the role of the Victorian Infectious Disease Laboratory as a reference laboratory, but I want to also say that our 2 laboratories, ICPMR and the laboratory headed by Professor Bill Rawlinson at Randwick, our Westmead laboratory has grown, it hasn't grown it. It has the testing available, and what we've been doing is sending some of the specimens to Vidral to actually validate the test as we're learning, because clearly what the tests were made up on is when China shared the genetic material. Obviously it's welcome news that they've been able to culture it. I'm sure there's other labs culturing it, and we'll make those announcements in due course if we've had success culturing it. But clearly sharing, I think what's really important is this sharing of knowledge across the laboratories, them working collectively and also globally to access the various primers and other things that have needed to support testing. We're also looking up and contingency planning should we need to increase testing capabilities. And as I said, whilst ICPMR was initially doing all the testing, we've now brought the second lab headed by Professor Bill Rawlinson online, and we will scale as the need arises.
And with school going back today, have you had any reports come through of sick kids at school, or does it appear that families are heeding those warnings to keep their kids at home if they've been to China recently?
That hasn't been fed back to me, any concerns. I think it's at times like this when the community is responsible, but the messages around not sending a child to school when you're sick is one we would encourage at all times of the year. We know that there are other respiratory viruses, other gastroenteritis viruses that can be spread easily in those school settings. So the messages I think we give out at many times of being alert for signs and symptoms of infectious diseases and not sending your children to school when they're sick is something that we'd like to make usual throughout the year. But we really appreciate that parents have responded to our messages.
Who should parents listen to with regards to sending their kids to school, because the state and federal minister are saying quite different things?
Our minister has, as at the press conference, has indicated that we're requesting that students from China not attend school for the 14 days from departure, and that goes back to the fact that we think the maximum incubation period is 14 days, and so when you depart China, that's not being exposed for that period. We actually urge parents to follow that advice, and that's been the advice promulgated through Education Department, and so that's the advice. We're asking them and requesting them to do that. But I think I've also clearly gave the message that if any child is unwell, it's very important that they contact their doctor, go to the local emergency department or ring Health Direct so we can actually diagnose them and exclude novel coronavirus where it's considered a possibility.
With the 2 cases reported in Japan and Germany where there was contagion before any symptoms showed, does that change the advice for people who recently returned from China at all?
That will be the basis of the deliberations for any update in our advice by the Chief Medical Officer later today. Clearly, I think I've said in previous conferences that the experts were clear that you'd have symptoms and then you become infectious. I think these case reports need to be viewed and provide some limited data of which we're going to have to continue to verify and reflect on. There are a number of challenges with this data, and we need to continue to share and learn, and that's why we're taking a very precautionary approach for any contacts of cases and testing them when they have very, very mild symptoms. But I think for me, one of the learnings is the fact that the disease can be, in all likelihood, quite mild. And so the message that we need to probably ramp up testing even when people have very mild symptoms probably reflects that we've got 16 new cases under investigation. And so we will be responding to new information, but people should be reassured that we've only detected 4 confirmed cases, and if this 16 comes back negative, again, it shows that we're testing lots of people when we're not finding them. So again, a reassuring message. But those test results, as you know, come back at a bit later in the day, and we release that in a press release as soon as we get them, and we'll similarly have that approach.
You mentioned that 2 of the confirmed patients have improved. What's the condition of the other 2?
So they remain clinically stable. So two patients are actually improving significantly and are moving towards discharged and being totally recovered. The others remain clinically stable.
And you mentioned before about not going with social media misinformation. Do you think there should be any kind of high-profile awareness campaign to limit busting from the government?
I'd like to also acknowledge our communications team, and I'd also like to acknowledge some of the advice we've been getting from a number of people that are informing us about the best way to get information out and the best way to target it to a particular communities. I also spoke to, and I'm doing a press conference later today with the Chinese Doctors Association. We recognise that we have to use a number of the social media platforms and amplify messages through platforms like WeChat, Weibo, as well as the traditional media and Twitter and Facebook. It's very hard to control and combat every social media post, and when they're in private networks, as you know, you sort of can't intervene unless you're actually part of that network. So it does provide some challenges to us in verifying that, and I acknowledge the key role that you have in getting out those facts, and the fact that we are going to be very open and transparent with what we know, and I think we've been very clear about what we don't know as well. So we'll continue to do our best efforts, and if you've got any other wise advice, we'd be happy to receive it. But we are trying to use every channel. We've also been doing separate Chinese media media conferences, and that's been really useful, and also asking some of those contacts to re-amplify messages through the WeChat platform. We've been translating things into Mandarin. We've been doing videos and podcasts with also one of our public health doctors, Dr. Zhang, who's at the back, in Mandarin. And so again, we are doing our best endeavours to reach out to the community, but happy for any other suggestions of how we could do it better.
You touched on the post briefly at the beginning, and I apologise for asking an obvious question, but to put this one to bed, can coronavirus be transmitted through food?
No. And could I just mention one other thing which I think has caused some confusion, is there are some coronaviruses, and some of them cause very mild respiratory issues. So sometimes when people get pathology tests, please don't be worried if your doctor says you've got a coronavirus. It's different from the novel coronavirus, and so there are coronaviruses that circulate in the community. So some people with respiratory screens will have come with coronavirus. It's easy to misinterpret that. So if someone says they've got coronavirus, we know about the form confirmed cases. So if there's been any reports that there's been other confirmed cases, all of our four confirmed cases are in Westmead, and we will advise you of any update on any other confirmed cases. Okay. Thank you.